Hey, welcome back to In Spite of, Because of, and we're going to talk about positive things, remember? And we're going to start with the positivity of infertility.
Yeah.
What?
You don't think that it can be that way, but it really can. I mean, it takes you a while to get there, but that's why we're here, and to kind of share our journey as far as where we were years ago in starting a family and some hard avenues we had to go through to get to where we are with our two beautiful children. And yeah.
So we're just going to share our stories. There's probably many of you out there who are struggling with infertility. I never thought that it would be an issue in my marriage. I don't know of anybody in my family who struggled with infertility at all. At least it wasn't talked about. I didn't know of anybody. I just thought that when my husband and I were ready to have kids that we would stop taking birth control and we would get pregnant and we would have a child. And that's not what happened.
No. And it's kind of scary, because you are probably like us in that you didn't know anybody that, had a difficult journey of becoming pregnant or to keep a pregnancy, to have a healthy pregnancy. And so it's very scary when you go into the doctor and as far as mine began was more of the pain avenue. And I just, when I stopped birth control, I was in a lot of pain and I couldn't figure it out, but I knew it had something to do with the birth control. And to this day, we still haven't figured out what it is, but it all started as pain. And I would go to the ER multiple times a month in severe, hunched over pain, and we couldn't figure out what it was. And then a couple months later, we went in and still with pain, and so they did more tests, that's their favorite thing to do. And they ended up finding a big mass, and we didn't know what it was, and so they went in, and it just happened to be a lot of scar tissue. And an exploratory surgery, and when they went in, they found that everything was attached to the scar tissue, and there was no way in God's green earth that we could have gotten pregnant on our own. And so they had to go and kind of fix it all up and make it look pretty inside so that we could try on our own. And that's kind of how our journey began. Do you want me to continue, or do you want to jump in?
Oh, I don't care. I guess I can kind of piece mine and then we'll go back to that. Mine's a little different. Mine was on the male side of the situation. I was off birth control for a year, and that was kind of what they tell you to do. Like you stop taking birth control and you give it a year, and if nothing happens, then you come to find out. And so we gave it a year, and we said, okay, nothing's happening, and we're trying, so let's go in. And so the first thing they did was they did an evaluation of my hormones to make sure that I was okay, and I came back fine. So then we knew that it probably wasn't me. My husband went in. He actually very graciously, they wanted to do a sperm count, and he made a deposit, and he got a call the very next day, and he was told that he had 0 sperm. Absolutely none. So he called me. Actually, I was at school, and he was crying, and I've never heard my husband cry before, ever, and to this day he still has not cried since then. But he told me that he had 0, and I had kids coming back to the room, and I just said, this is not how it will be for us, and I will talk to you when I get home. And I just really couldn't wrap my head around the fact that we would not have children. I would lay in bed at night with him, and I would say, I don't believe this. We will have children. And it's just something that, you trust your intuition when something is wrong, and you have to trust your intuition when you know that something will be right. And I'm sorry to get all emotional, it's going to be a positive or anything, but I know that there are other people going out there, and the male aspect is not really talked about at all, because men don't go around, I have 0 sperm. That's not a manly thing that you are like locker room talk, and as a man, how do you know? You don't know
until you get to that point.
That you have 0. So my first, in this day and age, was to Google all these types of things, and I came across a couple people on YouTube that and other people are like, oh, just get donor sperm, and for us, it just, I don't know, I love my husband so much. We wanted our child, and I have a niece who is adopted, and that and she is wonderful and not loved any less, but I just really knew in my heart that we were going to have our own child. So I will continue on with that in just a moment. I'm going to go back to Reagan as she shares a little bit more about her journey.
Okay, so once they taped me back together, I was pain-free for a couple months, and then the pain started back in, and this time it was more painful, and it was really hard to do my job as a life skills teacher, and just it seemed like we were calling the doctor more, going into the ER more, and so they finally set us up with a specialist, and sorry, I'm pulling on the tablecloth. So we went in to see a specialist, and we're like, okay, well, they're gonna run tests, and we're gonna find out that we just need to, try this, and, or take this medication, or do this, something that was just gonna be just a little add-in for us to continue on our journey of having kids. And, so they did, the sonograms, they checked me out, they checked my husband out, we ran through all these tests, and we went in, and they sat us down at a big table, and when they do that, it's not the best news that they give out. And actually we were told that we couldn't have kids, and that we needed to start in vitro if we wanted to have children of our own. And that's kind of where we were, that we didn't even get a shot at trying, to have children, just enjoying, what everybody else gets. We weren't going to get that route. And that was really hard. Even financially, I'm sure you've been there, that's a huge chunk of change, as far as, it's your life expenses. And then my husband and I weren't ready for that. We weren't prepared. We didn't even think that was anywhere near part of the conversation we were going to have that day. And then these questions were running through our mind, and then the next thing he says isn't just that we needed to have in vitro to have a child, it was then you needed to have a hysterectomy because there's something wrong with your system, and that's why you're having pain, and for whatever reason, we don't know why, but the birth control in that has mixed, and so you're going to have a child, and then you're going to need to have a hysterectomy. And so it wasn't just one blow, it was two at the same time. And we weren't prepared for that, and so it was extremely difficult to think that my entire life I always wanted to have my own children, and no matter how they came to be my own, that's what I wanted. And I just, I never knew of anybody that had that route, and it seemed to be the people that, maybe they started later in their journey of having children, maybe that's the route that they were going, but I never really heard that you can't have children, and we're going to take the rest of your women parts at such an early age. And I was, 28, I think, at the time. So to me, I was young. I was 27, it must have been 28, I don't know, but it was young. And so we decided we would start in the spring of that year, that we would figure it out, and that's how we were going to go about it. And then after that, maybe we would adopt, or we'd do foster care. We didn't really know where the journey was going to take us, but we knew we wanted at least one of our own. And so we looked at that, and we looked at a date, and so we planned out that we were going to start everything to where we'd be ready to have eggs transferred in February. And we thought, we've got this in a plan, and the doctor said, just keep, doing what you're doing. There's nothing else that you can do. There's nothing you can do, basically. And so we said, all right. So we just went and just, cried a lot about it, talked to our family, and just, ourselves had a heart-to-heart, with ourselves, what is our family going to be? And we never really thought too much further other than having kids. We didn't really think about what that journey was going to be like. But a little over a month later, we ended up pregnant, and we were shocked beyond belief that this wasn't supposed to happen. And guess what? It did. We went in, and I don't even remember why I went in, but maybe it was for blood work. I don't know. And I was like, whoa, wait a minute. I think we might be pregnant. So we went in, and sure enough, we were. And that's kind of where that particular fertility issue started and ended, and then a new issue began. But that's it for the infertility part for me. Yeah.
So mine's a little bit different, I guess, with the husband piece. We didn't share this information with our family or with friends because I kind of felt at the time that was, I don't know, just more private or more embarrassing maybe, I guess. And I think infertility kind of, it can feel shameful for some reason. It can feel like
it's not talked about.
Yeah, you don't really talk about it, especially, you know, and if you are somebody who's going through it and you're seeing, especially with the Facebook posts, and you just feel like everybody around you, you're driving in your car and you're at Target, and it seems like every lady you look at is pregnant. It's like, oh my gosh,
yes.
Why me? Why me? Why is this happening to me? And I think my husband just felt very guilty for some reason because it was on his end. And we didn't know, honestly, when we first got married, if we would ever have kids. Neither one of us were going to have 5, their names are going to be this. We just always said, you know, if at some point we decide to have children, we will, and if we don't, we don't. We were just, I don't know, we just weren't in that mindset. But then once we were like, okay, let's do have kids, and then this hill came about in our lives, and then it was tricky. So the first thing they did was then send my husband to a urologist to see if maybe there was some sort of blockage within the tubing that goes on in male areas. And so I went and I sat with him an appointment for that. And it's just so embarrassing for men. I think we, you know, we ladies, we go in yearly, we get our, you just something that you do. And for men, it's not something that you do so much. So he, you know, went back with the doctor, and I waited in the waiting room. He was gone for probably 5 to 10 minutes, maybe. Came back and we left. We didn't sit there and talk in the doctor's office. We went and we got in the car, and I said, so, you know, what did he say? Do they want to do further testing or surgery? He looked at me and said, you need to adopt. There is an absolute 0% chance of you ever having your own biological child. So once again, the tears came, but there was just still a gut thing within me that I don't know, I just didn't believe it. I don't know why I didn't believe it, because obviously if you have 0 sperm, you cannot make a baby. That's just scientific, right? But that's the whole thing with infertility, as, you know, whatever your faith may be, or your belief system might be, I think we all have a gut feeling that there's so much more to it than just the science piece. Cut to a few months later, I actually hurt my back and went to see the chiropractor, who were also a couple about my husband and I's age, and we went in and I was just getting adjusted and everything, and they didn't have kids either, and that just kind of, are you guys going to have kids? And that whole piece kind of got brought up. And they said, have you ever thought about, and they did acupuncture there too, have you ever thought about infertility acupuncture? And I said, well, no, I've never even heard of it. To me, you know, a chiropractor is when you hurt your back, you go in, they adjust it, and you leave. However, the gal there, I won't say her full name, but I just call her Dr. Lisa is what I call her anyway. But Dr. Lisa sat down with me and about an hour really talked me through a lot of chiropractic treatment that I didn't even know or anything about, and how much it can help you in so many aspects of your life. We could talk about that in another video. But basically, she specialized in infertility acupuncture, and what they did was they treated my husband by putting certain size needle, you know, just the acupuncture needles in certain places within his body, because that's what acupuncture is all about. And the needles stayed in him. He had 2 kind of in his back and 2 kind of in the nether regions area, not specifically in anything, but just down there. And what we did, or what we were told to do, was that whenever you were going to, we'll say, baby dance, whenever you're going to do your baby dance, you pushed on them and then you did your dance. And we did that, and every couple weeks he went in and they switched those needles out for some different ones. And this was in December, and by March we were pregnant. Wow. So I guess my piece with that is, you know, doctors are great and doctors are wonderful, and we want to think that they have the best intention, and they're just communicating with you and the information they know. And, you know, for the most part, what I've discovered is that the medical side doesn't really necessarily believe in the non-medical side of that kind of acupuncture and treatments and things like that. And then the acupuncture side may be a little bit on so much of the non-medical side too. Mm-hmm. So I think you want to seek out all all options and possibilities, and with the internet out there, and hopefully somebody like me speaking to somebody maybe reaches one person out there who's going through a similar situation. You never really think the male side that there is much you can really do about that, but and the female side too, they treat as well. So just a holistic approach of your options that are out there, because if we had just accepted the doctors as what they told us, then we would have just gone in possibly an adoptive route, because even in vitro wouldn't have been an option. A donor sperm would have been, but once again, if I don't know that, and then that's it's great for some people. It wasn't an area that we wanted to go to, but if we would have just accepted that first answer as the answer, then we wouldn't have our 2 children that we have. So, and after my husband received this treatment, we had absolutely no issues having our second child. And I guess
you didn't even have to go through that.
No. I guess in some ways he's cured. I don't know. He's cured now.
Enough.
He's cured enough to have created, naturally with no medications whatsoever, 2 children. So that is.
And I think even with that, I think. Even with me, we went to several doctors because we didn't want to accept the in vitro. So I think reminding yourself that you might have a wonderful doctor and you might think the world of them, but it doesn't ever hurt to go and ask another doctor. And even with that, we actually looked at going to Colorado because they have a special clinic there that they felt maybe they could do something that no one in Kansas City could do. And that was part of our journey as well with the in vitro. And we seeked out 2 separate doctors within Kansas City, and both had the same information. And so that's why we were looking at, I don't know what we really thought. We just were on the idea that maybe we would explore options in going to Colorado. And that's kind of where we were when everything kind of changed. But I think it's important that you get multiple opinions from a variety of specialists, because what one doctor says, another might have just researched something new to try, or the holistic approach, chiropractic, and even oils I think have worked, and the acupuncture, and just there's so many avenues out there that just really explore. If you're not ready to take no for an answer like we weren't, to really just explore and look for others who maybe have had success with something, maybe something you're going, oh my gosh, really, that would really work. It never hurts to try if that's what your dream is. And so just to really not take no for an answer, but to just seek out other people who might have other ideas and how that process might be different. So.
And for myself, I jumped on the YouTube and I said, what is this? And every video that I saw was a couple who were trying in vitro with donor sperm, or it was just scientific information about what, and I don't even know the technical term anymore, but what 0 sperm means. So, and sometimes it can be a combination of issues with the
female and the male.
The husband and the wife, the female and the male, whatever situation. It can be a combination of the 2. But once again, I encourage people to trust your gut. Know that intuition that you just
go
have, and just go with it. Don't accept your first no as your final answer, and seek those non-traditional things out there. For me, acupuncture was it's non-medication. There was nothing injected into my husband. There was no this isn't FDA approved yet, but you could try this kind of thing. It was just kind of a we'll try it and we'll see. And for us, it wasn't one of those, we tried for 2 months and we ran to the doctor and they're like, oh, you just need to relax. You just need to relax. I mean, we gave it a full year. I mean, I wasn't getting up and taking my temperature and charting and doing all those kinds of things, but we were trying enough that it should have, could have, and would have happened if not for our infertility. So we're both just hoping and sharing our stories with you today that if you're out there and you're going through infertility, whether it's similar to ours or completely different, know that it's a rough time. It truly is. It's a sorrowful time. It's a time to bond with your significant other, with no kind of judgment or... and
it's not abnormal to get mad at every woman you see that's pregnant or getting pregnant, or, it seemed like at that time, like, Trish said that everybody was getting pregnant, and it wasn't just getting pregnant, but oh, we just got married. Hey, a month later we're pregnant.
Yeah.
You know, and that was really hard, and it's really hard to be happy for someone who's at a place where you truly want to be. You're not being mean, you're not being rude, but it's you feeling how you should feel,
it's that
and not
enviousness.
to just put on a happy face. That it's okay to be mad and sad and, you know, and not be happy for every person that walks down the street that's pregnant.
Yeah.
And just know that. I think that was hard for me, to always be such a happy person and to be such a supportive person, to feel like I was mean and hurtful and hateful, because people were getting pregnant right and left. You know, and our journey continues, but this was a hard beginning, for us. So just know that you can be mad and you can cry and you can hate, and you should have a really good friend, who can let you say those mean, rude, terrible things, you know, as well as your husband. And know that your husband isn't going to understand quite possibly where you are. They're men. They try their hardest, but they're over it sooner than you are.
Right.
And they're not being mean either. They just, you know, a man just, oh, okay, well, we're going to move on, or we're going to do this, and da-da-da-da-da. And a woman, you know, sticks with that thought process. And so just know that it's okay. And that's why we're here, is to support you wherever your journey is with fertility.
Yeah, it really is a grieving kind of
totally
process, and
12-step.
yeah, it really is, and you're not alone. Like she said, it's okay to be envious of that. I think when our thing was coming out was really when I'm 16 and pregnant. The MTV show show was big. It was like, these kids aren't even ready to be parents, and I am. You know, I take good care of myself. I'm healthy. I'm financially stable. I'm in a loving relationship that's committed, and all these type of things. Why? You know, and that's just
It's hard not to question your relationship too at the time, because that was one of the things that we did was, not we. I mean, I did was. Well, maybe this isn't the right marriage. Maybe that was God saying, you know, oh, you're not with the right person. And that was hard for me to even think about. But it took me to a place where I never thought I would be. And no, that wasn't it. But for me, that was hard for me to think, well, maybe that was God telling me, you know, that you can't have children. You don't need children. Or there's, you know, it was hard because there were a lot of thoughts that went through my head. And all of those thoughts are okay. It helps you become the mom that you will be one day.
Absolutely. I think that all of those things are important. And I mean, in no way am I sitting here saying if your husband or you are experiencing infertility and you go do chiropractic acupuncture for infertility, you're going to get pregnant.
Right.
But it is an option to consider that no one had ever, my medical doctor hadn't discussed it with me. And then even after we got pregnant, we came back and we're like, okay, we're pregnant. It was like, oh, okay. You know, when I went to see my OBGYN, because my regular doctor had put down that was like something going on. And my doctor was like, okay, what'd you guys do? We done like, and he just said, you know, whatever works. It was my doctor's answer. So
awesome.
Find the positivity in your infertility if you can.
And run with it.
And run with it. And talk to people and explore your avenues. So have a blessed day.
Yes. Enjoy.
Enjoy.